Okay, let's talk about glomerular filtration barrier. Well, it is responsible for filtration of the plasma according to the size and charge selectivity. It is composed of, as we mentioned previously, it is fenestrated capillary endothelium. You have the basal membrane with type 4 collagen, changed in a heparin sulfate. And then we have the visceral epithelial layer consisting of podocytes and the foot processes, FBs. Look at picture A. So look at the picture A. We have podocytes. We have fenestrated capillary endothelium. And we have the glomerular basal membrane. So glomerular basal membrane and the fenestrated. So we have the podocytes, glomerular basal membrane, and the third thing is the fenestrated epithelium, or endothelium, my bad. Fenestrated endothelium. And the podocytes are also, we can call it, visceral epithelial layer, because those visceral epithelial layer consist of podocytes. Okay. So let's talk on the right side. What do we have? And before we go on the right side, so if you have a defect in type 4 collagen, you will have an Alport syndrome. Alport, por means 4, right? Type 4 collagen defect. Alpor, right? This heparin sulfate gives us negative charge. So when it gives us a negative charge, so it's going to, guess what? It's going to repel the negative charge. What things have the negative charge? Albumin. Albumin is negative charged. They are going to repel each other, right? But if you lose your heparin sulfate, you have no more negative charge. Guess what? Albumin is going in urine, causing albuminuria, right? Exactly. Let's now look. Charge barrier. We said there are two barriers. There's a size and a charge barrier. Selectivity barriers. We have the charge barrier. Glomerular filtration barrier contains negative charge glycoprotein that prevents the entry of negative charge molecules like albumin. And the size barrier, the fenestrated capillary endothelium, prevents the entry of greater than 100 nanometer molecules per blood cell. Okay, so greater than 100 is not allowed. Less than 100, come on in. Okay, so podocytes foot processes interpose with the glomerular basal membrane, GMB, leads to formation of slit diaphragms. With that, slit diaphragm prevents the entry of molecules greater than 40. So they are saying that you have this fenestrated capillary which allow less than 100, but we have another factor here that the slit diaphragms only allow greater than. So if something is greater, prevents the entry of, if something is greater than 40 or 50, those slit diaphragms come because of that. The podocytes attaching with the basal membrane forms the slit diaphragms. You can enter if you are 40 to 50, and you cannot enter if you're greater than 100. So you have to be less than 40 to 50 to go into the glomerular filtration. So that's what's called the glomerular filtration barrier, right? And some points to remember, or some other points are albumin, due to its small size. Why did I change the pen? Okay, albumin, because it is a small size, can cross the glomerular filtration barrier. but only repelled. But the only problem is repelled by negative charge, by the heparin sulfate. So low molecules. So what if I'm going back? If you don't have this negative charge, then the albumin is easily gonna go in and gets filtered. Second thing is the low molecular weight proteins. What are they? They are the beta-2 microglobin or Ig light chains. They are low molecular weight proteins. They can cross and they not only cross it, but also they get filtered. Get filtered by the glomerular filtration. But then once you do get filtered, they get reabsorbed in the PT. In the PT, they become reabsorbed. What's going on to the pencil now? Okay, now great. So PT is going to get reabsorbed. Okay. So what are the points to be remembered there? And we know all of these. These are composed of all of that. The negative charge, but the heparin sulfate to albumin can go. A size less than 40 will be able to go through the size selectivity, but the charge barrier remains there. If you are negative charge, you can go, but you're positive, you are welcome. Okay, moving on.